Ladies, if you have any kind of surgical procedure coming up, may I simply say, you better be prepared. That's why we're here, because if you wear green or blue nail polish, it could make a difference. And Dr. Natalie Strand, when I was reading this, I couldn't believe, having had a couple of procedures myself, although it didn't have anything to do with nail polish or eyeshadow, the things that we didn't know about your field as an anesthesiologist.
Well, there are some really easy and practical ways to keep yourself safe as you're heading into a surgery or a procedure.
Please tell us.
Well, you know, what you just mentioned, the nail polish, we don't really think about the pulse oximeter that reads our oxygen level, but if you're wearing a dark nail polish, blue, green, brown, black, that can actually throw off the reading a little bit. So it's an easy tip, you know, take your nail polish off or choose, you know, the reds and the pinks. But with the holidays, green and red is popular. Choose the red nail for your oxygen reading, not the green nail.
Most people don't wear eye makeup going into surgery, but if they happen to, from the standpoint of vanity and making themselves look good in the OR, what should they know?
Well, when you go under anesthesia, you lose your blink reflex. So keeping your eye safe is something that we worry about. If you have mascara on, for example, a little fleck could fall into the eye and either cause an abrasion or, you know, be a seed for an infection. So you'd be surprised. People come in full makeup. They're taking selfies before they go to the OR. Ladies, men, don't wear your makeup to the OR. Keep your eyes nice and clean. Take your contacts out, because we do want to keep your eyes safe during the procedure.
Excuse me, I would like to put this mask right now on your face so that you don't experience pain. No, I'm taking a selfie. Hold on, doctor.
It's not unheard of.
Dr. Natalie Strand is an anesthesiologist with the Mayo Clinic, and smoking, of course, is one of those things that we attempt to avoid and recommend against anyway.
Absolutely.
But for smokers, before they go into surgery, what should they do?
So if you're a smoker and you're having surgery, try to quit 4 weeks in advance. But if you can't do that, even quitting 48 hours in advance is going to help your blood carry more oxygen, which is going to lead to better healing and less chance of infection. So if you can hold off for even 2 days before your surgery, you're going to help yourself out.
Here was one that I told my wife last night, because she is prone to car sickness. And just simply don't ask me to read the map or anything like that in the car. However, if you are inclined toward motion sickness, you should tell your doctor why.
Absolutely. If you have motion sickness, you're more likely to have what we call PONV, post-operative nausea or vomiting. So there are things that your anesthesiologist can give you before the case, during the case, to help prevent vomiting and nausea after you wake up if you have a history of motion sickness.
Probably isn't a bad idea, considering the fact that we don't have the time to cover everything you ought to know, to get acquainted with your anesthesiologist before you go in.
Absolutely. You should have a chance to meet with your entire anesthesia team before your surgery starts. And so write down your questions so you don't forget. Make sure you have all of your questions answered before you go back.
Well, I will tell you, you have given me a totally different perspective before they put the mask on, and especially about my eye makeup and nail polish. I thank you so much, Dr. Natalie Strand from the Mayo Clinic.